Hey, what's up, YouTube? Welcome back to Express Pinnacle. I am Avinava, an MBBS student and a part-time cricketer. And before starting today's topic, I want to request to our viewers to please subscribe to our channel and show us some love in the form of likes and comments. Your support will be highly appreciated as I will be bringing some topics about education in the near future. So please support us. And today's video is about diabetes. So in this video, I will speak about two topics. So the first part of the video will be about the types of diabetes, the epidemiology, and the various symptoms to by which a normal person can understand if he or she has diabetes. And in the second part of the video, I will be talking about the etiopathogenesis of diabetes so that the MBBS students or the NEET aspirants can easily understand the topic. So without any further delay, let's start. What is diabetes? Diabetes is a chronic illness in which our blood sugar or blood glucose level is increased. So, how the blood glucose level will increase? So, we have to understand the functioning of a hormone which is known as insulin. So, what is insulin? Insulin is a hormone which is produced by the beta cells of the islet of Langerhans in the pancreas. So, if the body produces less amounts of insulin or the body produces enough insulin but the body becomes resistant to it, then it can cause diabetes. So, we can differentiate diabetes into two types, type 1 and type 2. Type 1 is known as insulin dependent diabetes, type 2 is known as insulin non-dependent diabetes. So, in the following sections, I am going to explain about these two diabetes more clearly. So, according to WHO, in India, 77 million people above the age of 18 years are suffering from diabetes and 25 million people are present who are at a risk of diabetes. So, in India, we can see an increase in the number of cases of diabetes. So, I want to explain about diabetes in this video. So, let us understand about the symptoms of diabetes. How can a normal person relate or if he or she has diabetes? So the first symptom is excessive thirst, which is known as polydipsia. So why does polydipsia happen? Because of the increased amounts of glucose in the blood, excessive amounts of glucose will come in the urine of the patient and the patient will face frequent urination. It is also known as polyuria. So, due to the excessive loss of water from the body in the form of urine, the patient will feel excessive thirst. So, in this way, polydipsia and polyuria, which is excessive thirst and excessive urination, are linked to each other. And the next point which a person can identify if he or she has diabetes is polyphagia, or it means that the person will feel to eat a lot, he will feel a lot of increase in appetite. So these are the three hallmarks by which a person can understand if he or she has diabetes. Normal level of glucose in fasting condition lies somewhere between 70 to 110 mg per ml, but in the case of diabetic patients the glucose level rises above 126 mg per pl. So routine blood test should be done for every patient to assess whether he or she has diabetes. What are the complications of diabetes? The first complication is atherosclerosis, which can lead to heart attack and stroke. The next important manifestation or complication of diabetes is diabetic retinopathy, in which there is deposition of galactitol in the lens and it can lead to cataract. It can lead to other systemic manifestations also, like it can lead to gangrene formation in the legs. In long-standing diabetic patients, as the blood glucose level is very high, there is a high chance that the extremities of the body where there is not enough blood supply, there might be infection or there might be infection due to staphylococcus or streptococcus bacteria. Serious complication of diabetes remains to be diabetic nephropathy, in which there is destruction of kidney tubules, there is renal damage, due to which there is anuria or there is oliguria, in which the urine formation and the urine excretion from the body is hampered. So there might be renal failure. So it is one of the most serious condition and it might require kidney transplant or dialysis. So let us now discuss about the lifestyle modifications for persons who are suffering from diabetes. The first thing is you should exercise regularly for at least 150 minutes or 1 hour 30 minutes. The next thing is have a balanced diet. Stop consuming excess amounts of animal fats, and you should have a rather balanced approach in diet, like you should take adequate amounts of vitamins, minerals and other nutrients in your food. The next thing is you should have proper stress management. If you are working in a corporate sector, you should always go with a counselor to manage your stress. The other things which can be done are yoga, the and others. So you should also limit your alcohol intake in order to reduce your chances for diabetes. Avoid taking sugary foods like the ones which are available in packaged forms, and you should always have adequate amounts of fruit juice and all other healthy stuff so that you are at a less risk of suffering from diabetes. This is the second part of the video where I will talk about the etiopathogenesis of diabetes. So there are two types of diabetes, type 1 diabetes and type 2 diabetes. Type 1 diabetes is an autoimmune disorder in which the autoantibodies are produced against the beta cells of the islets of Langerhans. So there is increased destruction of the beta cells and it causes inadequate synthesis of insulin from them. And type 2 diabetes is a condition in which there is increased resistance of the body against insulin. It is due to various factors. It can be due to obesity, it can be due to unhealthy diet, it can be due to alcohol, it can be due to smoking. Topics about various types of diseases and also videos about NEET examination. So please subscribe to our channel and show us some love in the form of likes and comments. And I am Avinava and this is me signing off.